This simulation demonstrates appropriate techniques, equipment, and body mechanics to reduce fall risks. Falls are serious and can lead to patient or healthcare provider injury, including broken bones, lacerations, and blood loss. Falls can even lead to death. Before we begin, we need to perform hand hygiene. To wash your hands, point at the hand hygiene button and press the trigger. We'll use this button throughout patient care as necessary, including when entering or leaving the patient's room. For this procedure, we'll need a gait belt, non-slip socks, a chair alarm and pad, and a blanket. Point to the privacy curtain and press the trigger to close it. We need to position the wheelchair so it's close to the head of the bed and at a 45-degree angle. Touch the wheelchair to move it into position. It's crucial that the wheels are locked so the wheelchair cannot move while we transfer Riley. To lock the left wheel, grab the lock handle and pull it down. Now lock the right wheel. Grab the lock handle and pull it down. We'll also move the footrests out of the way. Select the footrests to position them. Since Riley is a bit impulsive and hesitant to ask for assistance, we'll use a chair alarm and pad while he's in the wheelchair. A chair alarm will not prevent him from standing up, but it will alert healthcare staff to assist him and reduce risk of falls. Pick up the pad from the bedside table. Place it in the middle of the wheelchair seat. Retrieve the chair alarm. Place it on the back of the wheelchair. Touch the cord to attach the pad to the alarm. Excellent. I'll turn it on so it's ready to use. I verified that the bed is in the lowest position after it was moved to make room for the wheelchair. We must lock the bed brakes before making other adjustments to the bed. Select the left one to lock them all. We also need to lower the side rail. Touch the rail closest to the head of the bed to lower it. To ensure patient safety, we need non-slip socks on Riley's feet. Let Riley know we're about to move the sheet. Select the Talk to Patient button. Select what you want to say to Riley. Select the Submit button. Riley, we're going to move the sheet out of the way so we can put socks on your feet.
That's fine.
Touch the sheet to move it out of the way. Get a non-slip sock from the bedside table. Put it on Riley's right foot. Pick up the other non-slip sock. Put it on Riley's left foot. Great. We need to prepare Riley to sit up. First, we need to position our body to use proper body mechanics and reduce risk of injury. Watch the movement required to sit the patient upright. Pay close attention to the healthcare provider's leg and body position. Turn to face the patient's hips at a diagonal with your right foot slightly in front of your left and your feet shoulder-width apart to create a base of support. Bend your knees slightly. Stand here to get into the correct position. Touch the up button to raise the head of the bed about 15 degrees. We need to let Riley know we're getting started. Select what you want to say to Riley. Select the Submit button. Riley, to assist you into a sitting position, we're going to place our hands on you, all right?
Okay.
Reach your left arm over both legs and grasp near his knee. Use your right hand to grasp Riley's left shoulder. You'll use both hands to move Riley's upper body to an upright position while his legs come off the bed. You'll shift your weight and pivot towards your back leg as you do this. In one motion, use both hands to move Riley to a sitting position on the edge of the bed. Give Riley a moment to adjust to this change. Changing position can alter some patients' blood pressure, so allowing them time to adjust before removing your hands or moving the patient to the next position can reduce risk of falls. Continue holding Riley with one hand and ask him if he's dizzy. Riley, do you feel dizzy or lightheaded?
No, I feel fine.
Good. Remove your hands. Riley, make sure your feet are flat on the floor and about shoulder width apart. Are Riley's feet positioned correctly? Select the answer you think is correct. Select this. That's right. His feet are flat on the floor and about shoulder width apart. If your patient's feet cannot reach the floor, help the patient scoot closer to the edge of the bed until their feet are on the floor. We'll use a gait belt to assist with transferring Riley to the wheelchair. A gait belt is an assistive device that gives healthcare staff a safe place to hold on to the patient and reduces risk of injury and falls. There are many types of gait belts, such as fabric and vinyl, so be sure to follow the manufacturer's instructions for use and cleaning. We're going to use a fabric gait belt, which includes a buckle and a strap with a metal tip. You'll thread the metal tip through the back of the tooth side. Then you'll loop it over the middle divider and through the open notch. Tell Riley we're going to put the gait belt on him. Riley, we're going to put the gait belt on you now.
Sounds good.
Get the gait belt from the bedside table. Place it around the smallest part of Riley's waist. I'll hold it in place. If there were any tubes or wires on the patient, you'd need to ensure they were not underneath the gait belt when you put it on them. You'd also need to make sure any tubing or wires had enough slack. And remember, always seek assistance when you need it. Is the gait belt twisted? Select the answer you think is correct. Select the... Loop the metal tip over the middle divider and through the open notch. We need to check that only 2 fingers fit between Riley and the belt to make sure it fits correctly. Place your extended fingers between Riley and the belt. Good. The belt fits correctly. I'll tuck the loose end into the back of the belt so it stays out of the way. There. Tell Riley how we'll help move him. Select what you want to say to Riley. Select the Submit button. Riley, we're going to have you rock back and forth 3 times before standing up. We'll be holding onto the gait belt to support you. On the count of 3, we'll help you stand, then help you into the wheelchair.
Sounds like a plan.
We need to make sure our body mechanics are correct during this interaction to prevent injury. Note the starting position of the healthcare provider and how they bend at the knees as they help the patient stand. Stand in front of the patient with your legs about shoulder width apart. Your right leg needs to be positioned between the patient's legs so you have a free leg to help control the movement. Position your legs now. You'll use the strength in your legs, not your back, to help Riley up. Grasp both sides of the gait belt. We're going to rock with Riley 3 times. With each count, move with him slightly back and forth, shifting your body weight and his. On 3, use the gait belt to assist Riley to stand. Here we go, Riley. Rock forward and back. 1, again. 2, last time. 3, now stand. Keep holding the gait belt while Riley finds his balance. Use one hand to check if we need to tighten the gait belt now that he's standing. Place your fingers under the belt. The belt still fits snugly. Grasp the gait belt again. Watch the healthcare provider's body position as they help the patient into the wheelchair. Their knees are in line with or just outside of the patient's knees. They pivot on their left toes with most of their weight on the heel of the right foot. You'll pivot on the toes of your left foot with most of your weight on your right heel. When you complete the pivot, your left foot will be slightly behind the right to counterbalance yourself as you hold on to the gait belt. Position yourself correctly before you pivot. Riley, it's time to pivot into the wheelchair by moving your feet and angling your body so the wheelchair is behind you. Then you'll need to reach back to find the armrests and sit down. We'll support you with the gait belt. Remember to bend at the knees when lowering Riley. Guide Riley into the wheelchair. Since Riley's hips are touching the back of the chair, you may release your grip on the gait belt. Ask Riley if he's comfortable. Do you feel comfortable?
Yes, thank you.
Remind Riley about the chair alarm. Riley, the chirp sound you heard was an alarm and pad that's on your chair for your safety. If you get up from the chair without assistance, an alarm will sound to notify the healthcare team.
Okay, I'll try to remember not to get up on my own.
We're going to move the footrests back into place since you're about to be transported.
Thanks.
Select the footrest to move them into their original position. We'll also remove the gait belt. I've untucked the end of the belt strap. Pull the belt strap out of the notch. Stabilize the buckle with your left hand. And use your free hand to pull the belt strap away from the tooth side to remove it. I'll take that and put it away while you check if Riley wants a blanket. Riley, would you like a blanket on your lap to keep you covered and comfortable?
Yes, that would be nice.
Retrieve the blanket from the bedside table. Place it across Riley's lap. Select the privacy curtain to open it. Ask Riley if he needs anything else. It sounds like the transport personnel are here for you. Before we go, is there anything else you need?
No, I'm good.
Perform hand hygiene before you leave. I'll document the transfer in Riley's chart. Well done demonstrating appropriate techniques for transferring a patient from bed to wheelchair using a gait belt. These practices improve patient safety and reduce fall risks. It's time to try it on your own. You'll be scored for this, and I'll be here if you need anything, but you will lose points if I have to help. Select these buttons whenever you need them. I need your help transferring our patient Heather from the bed to a wheelchair using a gait belt. I confirmed her identity and explained the procedure, and she gave consent for us to continue. What happens first? For this procedure, we'll need a gait belt, non-slip socks, and a blanket. We do not need an alarm and pad for Heather. What must you do for patient privacy? Show me what to do now. Keep going. I've verified the bed is in the lowest position. What needs to be done first? What else? Tell Heather we need to move the sheet. Heather, we're going to move the sheet out of the way so we can put socks on your feet.
Okay.
Continue. Well done. Position yourself to help Heather sit up. All right, remember what to do now? Good. Tell Heather we're going to help her sit up. Heather, to help move you into a sitting position, we're going to place our hands on you for support, all right?
Okay.
Proceed. Now what? Heather, do you feel dizzy or lightheaded?
No, I'm fine.
Good. Let go of Heather. Heather, make sure your feet are flat on the floor and about shoulder width apart. Are Heather's feet positioned correctly? I agree. Heather's feet are flat on the floor and about shoulder width apart. She's ready for the next step. Tell Heather we need to put the gait belt on her. Heather, we're going to put the gait belt on you.
That's fine.
Go ahead. I'll hold the gait belt in place. Is it twisted? Yes, the gait belt is twisted in one place. I'll fix it. Continue with the next steps. What do you need to check? Good. The belt fits correctly. I'll tuck the loose end into the back of the belt so it stays out of the way. There. Explain the next steps to Heather. Heather, we're going to have you rock back and forth 3 times before standing up. We'll be holding on to the gait belt to support you. On the count of 3, you'll use your arms to push up off the bed. We'll help you stand, then help you into the wheelchair.
I understand.
Move into the proper position. Yes. Now what? I'll count as we go. Rock forward. 1, 2, 3. Now stand. Good job. What should you do next? The belt still fits snugly. Position yourself to transfer Heather. Let Heather know we'll help her into the wheelchair. Heather, it's time to pivot into the wheelchair by moving your feet and angling your body so the wheelchair is behind you. You'll need to reach back to find the armrest as you sit down. We'll support you with the gait belt.
Sounds good.
Proceed. Heather's hips are touching the back of the chair. You may release your grip on the gait belt. Check if Heather's comfortable. Do you feel comfortable?
Yes, thank you.
We're going to move the footrest back into place since you're about to be transported.
Okay.
Show me. We'll also remove the gait belt. I've untucked the end of the belt strap. You do the next part. Continue. I'll remove the gait belt and put it away. Heather, would you like a blanket on your lap to keep you covered and comfortable?
Yes, that would be great.
What should you do now? It sounds like the transport personnel are here for you. Before we go, is there anything else you need?
No, I'm fine.
What's the last thing you need to do before leaving Heather's room? I'll document the transfer in Heather's chart. Great job demonstrating appropriate techniques while transferring the patient from bed to wheelchair using a gait belt. These practices improve patient safety and reduce fall risks.